Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist performs the carpal compression test, Durkan's test, on a patient who complains of pain and paresthesia in their hand. The purpose of this test is to compress which of the following structures? Option 1, median nerve. Option 2, radial artery. Option 3, ulnar nerve. Option 4, ulnar artery. The carpal compression test, or Durkan's test, is a neural provocation test used to identify carpal tunnel syndrome. During the test, the therapist applies direct pressure over the carpal tunnel to see if it reproduces symptoms such as numbness, tingling, or pain in the hand. This is a straightforward question once you know two things: what structure passes through the carpal tunnel and where the carpal tunnel is located. The question is essentially asking you to connect the test to the structure it targets. Let's make sure that connection is crystal clear. Let's explore each of the options. Option 1, median nerve. The carpal compression test, also known as Durkan's test, involves direct pressure over the carpal tunnel, compressing the median nerve in the carpal tunnel to reproduce symptoms of carpal tunnel syndrome. Option 2, radial artery. The radial artery runs along the lateral aspect of the wrist near the thumb. It would not be compressed during the carpal compression test. The radial artery is on the wrong side of the wrist for this test. It does not pass through the carpal tunnel, and applying pressure over the carpal tunnel would not significantly compress it. Option 3, ulnar nerve. The ulnar nerve passes through Guillen's canal at the medial aspect of the anterior wrist. It would not be compressed during the carpal compression test. This is a completely different passageway from the carpal tunnel. Compression of the ulnar nerve at Guillen's canal would produce symptoms in the ulnar nerve distribution, the little finger and medial half of the ring finger. Durkan's test targets the carpal tunnel, not Guillen's canal. Option 4, ulnar artery. The ulnar artery also travels through Guillen's canal alongside the ulnar nerve. It would not be compressed during the carpal compression test. This option and option 3 can essentially be eliminated for the same anatomical reason. When we place our thumbs over the carpal tunnel and apply direct pressure, there is only one neural structure in that space that we are targeting, the median nerve. Everything else is in a different location entirely. The correct answer is option 1. Let's explore the all-student data. 89% of students selected option 1, median nerve, the correct response. 3% of students selected option 2, radial artery. 6% of students selected option 3, ulnar nerve. 2% of students selected option 4, ulnar artery. This question is a neuromuscular and nervous systems question which represents approximately 24% of all exam items. This question is a physical therapy examination question which represents approximately 24% of all exam items. This question is a Level 1 question, since the question requires students to possess basic, foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Looking to review related academic content? Check out page 109 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.